Make sure everybody's on before we get started. Give it another second. That's good. So just wanted to thank everybody for taking a little bit of time on an extraordinarily busy Friday with so much going on, so much that is being advanced, not just in Washington, D.C., but all across the globe. But I really wanted to circle back on such a foundational and profound and consequential decision that's about to be made by the United States Senate and advanced back to the House of Representatives as early as next week. And I wanted to underscore how consequential, how profoundly meaningful this big, beautiful betrayal, this bill that President Donald Trump is advancing in Congress. We wanted to paint a picture of the betrayal and put a perspective here in the state of California at how consequential it is. I will set out the numerics. I'll give you a sense of the estimated impacts on the state specifically, but I'm pleased and blessed to be joined by Director Boss and by Secretary Johnson, who will start to paint a human face and put a human face on the impacts of these devastating healthcare cuts that likely will be landing on the president's desk very, very shortly. Let's just quickly go over some of the top lines on the bill. You see a lot of different estimates out there, and we've all been struggling, I think, with trying to understand the magnitude of what the experts, quote unquote, are estimating to be the actual cuts to Medicaid coverage all across the United States. You can just see three just random examples. The Congressional Budget Office. This is, again, specific national impacts to Medicaid coverage loss alone. This is not the totality of the bill in terms of health care coverage reductions, but it gives you a sense of the Medicaid specifically. You see the Urban Institute has a different number and a substantially higher number by the Center of Budget and Policy Priorities, some 14.4 million Americans. So we've been analyzing all of that. We've been reviewing the details of the House-passed bill, the amendments, the birdbath, as it's referred to, as it relates to what's in, what's out on the Senate bill. This is a snapshot of what we know today and what we anticipate will be happening tomorrow and over the weekend. Up to 3.4 million Californians are at risk of losing health coverage specific to the Medicaid and under our Medi-Cal system specific to the bill. Some $28.4 billion of federal funding is at risk that's associated with those losses. So 3.4 million. And I remind folks in California, we have about 15 million people on Medi-Cal. It's a substantial number that are at risk of losing health coverage. Here's the breakdown. About 3 million people, we estimate, will be directly impacted by the work requirement and the paperwork. And I should note the paperwork, that's an actual PDF example of the paperwork that people will have to submit to for their eligibility checks. And that impact every 6 months, we think, will reduce the number of people getting health coverage by 400,000. The paperwork you see there is 36 pages long. Just gives you an example, or at least a perspective, I hope, on the magnitude of what that paperwork means. There's a hassle factor, and that's exactly what they're counting on to score the savings, to score the cuts in terms of these new requirements. So the work requirement, we estimate that about 5.1 million people would be subject to these new rules, of which a third likely will have met. And this is based upon our assessment and analysis, based on our data runs, that about a third of 5.1 million people, 5.1 million of the 15 million, that will be subject to the new requirements under the big, beautiful betrayal. And a third of them will likely, and this is an estimate, meet that work requirement, which is 80 hours, income, and wage levels. The other 2/3 will go through the labyrinth of manual verification, et cetera. We did some very comprehensive analysis based upon some real world examples. I'll give you two specific examples in Arkansas and New Hampshire as it relates to the self-verification and the manual process. And we came up with numerics based upon the number of people that dropped out of their program when they instituted those verification procedures. And we blended that and came up with a percentage that ultimately led to the number you see on the screen. And forgive me for confusing you, but we've really dived deep and really tried to stress test our estimates. And we feel very confident that up to 3.4 million people will lose their coverage if this bill passes under the Medicaid system, just in the state of California alone. But that is not it. I want to remind you of the monthly premium increases. Millions of people will also face under Covered California. I'll also remind you, Covered California is not a general fund backed program. It's not a state program in that respect. Covered California, however, will see premium increases for roughly 2 million recipients. And we estimate on that basis that as many as 600,000 additional people will drop that coverage. So 3.4 million on the Medicaid side under our Medi-Cal system, an additional 600,000, 4 million people likely to lose health coverage, increasing uncompensated care, moving from one of the nation leading low uninsured rates. We're about 6.4% currently, one of the nation's leaders in terms of health care coverage and support. And to see those numbers increase by as much as 4 million people. Now, we can talk a little bit about what that means, but no part of our state, and for that matter across the United States, or other parts of our country, will be more impacted than the impact of this betrayal on rural communities. And I don't think it's an exaggeration to say devastating rural communities. And let me back that up by providing you just some enrollment data. You can see here the Medi-Cal enrollment by county. This is a percentage of total population. Upwards of 64% of some jurisdictions, some counties in the state of California, 64% of all of the residents in those counties are on Medi-Cal, on national Medicaid. Just to put it in perspective, who this really hurts. I'll remind some of you that may recall, it wasn't that long ago, just a few years back, in an effort to address the crisis for rural hospitals, we initiated a program in partnership with the legislature that funded, this was a state loan program that funded, because the crisis already in providing care in rural hospitals, provided to 16 hospitals in these 14 counties, $300 million in state loans. I think it's incredibly important to highlight. We had 3x, over $900 million of applications to seek the $300 million in loans. That's how distressed our rural hospitals are today. Imagine in counties that have 64% of their population on Medi-Cal, like counties that are represented by people like Representative Valadeo, who enthusiastically supported these unprecedented healthcare cuts, the most significant healthcare cuts in American history, who enthusiastically embraced that bill and voted for it, when 64% of his own population will be devastated and impacted. That representative, whose district abuts this healthcare district alone, that received that distressed loan. Imagine the impacts to this healthcare district that is adjacent to that same representative's district, or the district by this Representative Keeley, Ridgecrest, adjacent to his district in Kern County, 54% of the population in that county on Medi-Cal. What's going to happen to Ridgecrest Regional Hospital? They're already on the ropes. They're already struggling. That same Representative Keeley, enthusiastically supporting, gutting this program, cutting these funds that will disproportionately impact these hospitals that many of his constituents, again, adjacent to his district, are benefiting from. Representative McClintock, the same, up there in John Fremont Healthcare Hospital District. So this is serious. The betrayal, the big, beautiful betrayal, gutting an already vulnerable system where $300 million of distressed loans the state had to put up before this big, beautiful betrayal was promoted. And you have representatives in these very districts promoting this betrayal, supporting these devastating cuts, gutting networks of providers, the healthcare industries, which will lead to thousands, hundreds of thousands of jobs lost. About 2/3 of those, a report that was just done by UC Berkeley, about 2/3 of those 217,000 jobs they estimate will be lost specific to the healthcare sector in skilled nursing homes, boarding care, hospitals, nursing homes, doctors, nurses, jobs lost, unemployment going up. Another third of those, people providing food and providing other contract and support for the healthcare delivery system. So devastating cuts, devastating impacts on hospitals, providers, healthcare coverage, uncompensated care, people struggling, suffering, premiums going up for close to 2 million people, hundreds of thousands of people that can't pay for those premiums. Now losing coverage completely under the Obamacare, under covered California, and an increase of unemployment. That's what the Trump administration's promoting, and that's what Republicans in Congress representing many of these districts have already supported. And by the way, I referenced that $28 billion impact. That doesn't include a potential additional $4.3 billion penalty because California chooses to use its own money as the federal government uses our money, over $80 billion that we provide more to the federal government than we receive for the federal government. As they cut what comes back to our state, they want to cut an additional $4.3 billion because we want to provide for mixed status families, provide for those that contribute over $8.5 billion a year in tax revenue just to the state alone, people that are out there working the fields, that are working hard every single day, not just in the fields, but many of them working in boardrooms and classrooms and working to take care of our seniors, many working in those same hospitals that they want to cut. So that is an additional $4.3 billion penalty that they're promoting. I'll remind you as well, $305 million just to gut the funding for cancer screenings, for contraception, for STI testing, to gut Planned Parenthood funding. That's in the bill. $305 million. The state puts out about $150 million. They would remove eliminate all of that funding. That's what these House of Representatives already adopted and what the Senate is proposing to adopt. Never in my lifetime, in our lifetimes, have we seen these kinds of cuts, the magnitude that will be profound in terms of the impacts on this state, the quality of people's lives and their livelihoods. And I haven't even gotten to slashing food assistance. I mean, where's the morality to the least of us? I'm old enough to remember what Father Cause taught me, what the Bible teaches all of us, Speaker Johnson. 735,000 Americans are at risk of losing the access to food, to nutrition programs, educational assistance grants. They're looking to charge penalties up to 25% cost share in states like California. Big, beautiful betrayal. That's what's being promoted to do what? To do this, to provide tax cuts to people who aren't even asking for them and don't even need them. Disproportionately skewed to the wealthiest among us. You think I'm exaggerating? Take a look at the CBO's own analysis. $1.1 trillion of tax cuts for people making over $500,000 a year. How do you pay for that? Well, they don't even pay for it, but they get close. You gut food assistance to poor people. You gut basic medical care, preventative care to folks $715 billion just in the Medicaid cuts. That doesn't even get you to $1 trillion. And you make up the rest by selling out our kids and grandkids, by financing deficit and debts to then provide even additional dollars to folks, millionaires, not just billionaires, again, that aren't asking and don't need these tax cuts while raising taxes on low-income Americans. It's a fact. Read your own bill. They increase tax on folks, I think, down to $30,000. Their taxes start going up in 2029. So that's the state of play with this bill that's being promoted. Forgive the intensity, but I never thought I'd see this in my lifetime. This is devastating. And I know that word is often, well, it's overused in this line of work. But this is, in many ways, an understatement of how reckless and cruel and damaging this is to millions and millions of people all across this country, but more than any other state here in California. And so my state of mind is resolved to continue to call this out. People need to make phone calls, call their representatives. How shameful. I don't know how these people can walk their districts. How shameful it is for these representatives, these Keeley types and Valadeo, to walk their districts and to betray their own voters like this. And for Donald Trump to anyway, shape, or form, say it's not going to impact or hurt anyone like he did today when he lied about that today. What a shame. What a disgrace that someone could actually assert that, let alone perhaps even believe it. Someone who happens to be, in this case, the president of the United States. So we're going to continue to do what we can to activate. I'm grateful. We have remarkable leaders and our 2 U.S. senators and of course the congressional delegation, Democratic congressional delegation. They'll do their best, but we've got to brace for something the likes of which we, in our worst case scenario, could have never imagined. That is arguably just a week or so away. With that, forgive the long-windedness, I'm blessed to have our Secretary, Health and Human Services, Secretary Johnson, amplify and perhaps fill in some details that I omitted.
Thank you so much, Governor, and appreciate the opportunity to do that amplification. Just to leave off, you left with the CalFresh program. This is California's Supplemental Nutrition Assistance Program. We're talking about 5.5 million low-income individuals in California, 3.3 million households accessing food they need to thrive. The proposals result in a loss of that access. Benefit levels that will not keep up with the ever-increasing cost of food will limit access to nutrition education services that support healthier food choices. As you said, these proposed cuts, these are not abstract. These are immediate threats to the well-being of millions of Californians and will impact all of us. The governor just referenced one of the major drivers of the loss of benefits is the proposed implementation of work requirements for individuals participating in both CalFresh and in Medi-Cal. This isn't about the value of work. These are proposals that are intentional sets of requirements aimed to increase the burden of those accessing healthcare and food and nutrition supports so that they no longer have this access. We believe in the value of work and community engagement, and in fact, have a successful employment and training program embedded into our CalFresh program today, which includes strategies that address the barriers individuals experiencing poverty may be facing in engaging in work. Work requirements have appeal because they align with the widely held value of work. However, in practice, they do not help people find or keep jobs. The lessons learned from other states implementing the work requirements, as the governor mentioned, in Arkansas, Medicaid work requirements had no measurable impact on employment. Half of affected individuals reported problems paying off medical debt. 56% delayed care due to the cost. 64% delayed taking necessary medications. These results are devastating, and these administrative hurdles or hassle factors ultimately undermine access to necessary care that has been shown to help low-wage workers become or remain healthy enough to work. In addition to the work requirements under the Republican proposals, many Medi-Cal participants would also have to prove their eligibility every 6 months instead of once a year beginning in 2027. As you heard, this alone could cause up to 400,000 Californians lose Medi-Cal coverage, most of whom will have still been eligible to receive it. We are in California guided by a vision of a healthy California for all, and these proposals roll back progress we've made together in achieving this vision. California's healthcare infrastructure is also at risk, and so I'd like to turn it over to Director Boss to say more about the provider impacts of these proposals.
Thank you, Secretary. We're here today really because Medi-Cal matters. It serves nearly 15 million Californians, roughly 35% of the state, including 5.5 million children and teens. It supports older adults and individuals with disabilities. Medi-Cal is more than just healthcare. It's a lifeline for the Californians it serves, providing access to vital medical and dental services, preventive care, mental health support, substance use disorder treatment, and care for chronic conditions. The proposed Medicaid changes by congressional Republicans and proposed federal rules regarding healthcare taxes would cause widespread harm by making massive reductions in federal funding and potentially cripple the healthcare safety net that all Californians depend on. These changes put tens of billions of dollars of federal funding at risk for California and could result in a loss of coverage for millions of Californians. Under this proposal, significant restrictions are placed on state funding tools and vital mechanisms, thereby destabilizing the Medicaid system. California, like 48 other states, relies on state taxes from providers and managed care organizations to bring federal matching dollars. The proposal would freeze these taxes and ban new ones, threatening this fundamental funding stream. Additionally, under this proposal, the federal government is also changing how it decides whether these state taxes are permissible and imposes more limitations and restrictions on these taxes. Several of California's major current provider taxes wouldn't qualify under the new rules, putting billions of dollars that fund the Medi-Cal program at risk. Provider taxes are essential to keeping hospitals, nursing homes, physicians, and other healthcare safety net providers stable. This cut may be fatal for the many rural and critical access hospitals that are already financially strained. This bill would also limit how much federal funding hospitals can receive through certain types of directed payments. This would mean less funding for both public and private hospitals in California. If a hospital is forced to close, every member of the community loses access to hospital care, not just the 1 in 3 Californians covered by Medi-Cal. These proposals would fundamentally undermine our capacity to serve and provide care where people need it the most, with consequences that extend far beyond Medi-Cal. These proposals will impact our emergency departments, rural hospitals, private and public hospitals, community health centers, ambulance providers, and the broader healthcare system that serves every community. Thank you.
Thanks, Michelle. So that's an overview of what we know today. Obviously, we continue to analyze all of the amendments that are being made in real time. What happened over the course of the last 48 hours as it relates to the Senate parliamentarians' assessment of what can and cannot go into the bill. Of course, there's a lot of workarounds as it relates to that. So they're being very aggressive in trying to find ways to continue to impose more harm, candidly, on communities all across this country. But the magnitude, again, of this cannot be understated. The magnitude of this simply cannot also be absorbed by backfilling through the state general fund. And while we are moment balancing our own budget, we are certainly mindful that this will have a significant impact, some of it more immediate, some of it rolling over the course of a number of years, 2027, 28, 29. But the impacts of that as we begin to address work requirements and create new system of eligibility, all of that will start to occur and have some immediate impacts. So we cannot, again, be passive in our capacity to be flexible and to address some of the intended and unintended consequences in real time. With that, we're happy to answer any questions.
If you're a member of the media and you would like to ask a question, please click the raise hand icon at the bottom of your screen and then unmute yourself when called upon. And again, please click the raise hand icon at the bottom of your screen if you're a member of the media and you would like to ask a question. And our first question goes to Alex Michelson with Fox LA. Alex, please unmute yourself.
Hi, Governor. Alex Michelson, can you hear me?
Perfectly.
So, some of your critics will point to the fact that the state spends billions of dollars on health care for the undocumented currently. Could that be a way to save money going forward?
Well, we have universal health care. It's called the emergency room. It's called sick care. We pay for it on the back end, or we can pay for it on the front end. There are a few states that don't provide some basic care, particularly pregnant women, people that come into the emergency room. That's universal coverage in this country, regardless of your immigration status, ability to pay, or any pre-existing conditions. California, among many other states, has prided itself on providing support for our children that are particularly living, and many of them living in mixed income or mixed status families, and seniors. And California, of course, expanded that coverage further. We also put a limit on it, and that's the budget that the legislature today will sign. But these cuts go well beyond the scope of that expansion. I'll remind you, $8.5 billion a year is contributed by undocumented residents in this state. You're talking about $30+ billion of impacts because of these cuts to pay, again, for tax cuts for people that aren't asking for them and don't need them.
Are you getting a sense that this message is working, that any of the Republican members of Congress that you're talking to, that California's lobbyists are talking to, are willing to push back on this and that this thing might not actually pass?
Well, they won't be working in 18 months. They'll be out of a job. I can't even conceive of being representatives in those districts, particularly where you have 50 to 60% of your entire district population, the people you quote unquote serve, and you're gutting their access to care by increasing their premiums for those that are on the exchange, eliminating their coverage in many cases if they're off on Medicaid, but also, and I thought it was an incredibly important point that was just made, significantly increasing the likelihood that everyone else that's not even directly impacted becomes indirectly impacted because the hospital that they are in desperate need of accessing no longer exists, because the hospital will go out of business in real time. Those distressed hospital loans came at a time of abundance. Those distressed hospital loans came at a time when we had much more stability with state funds and federal funds. And they were 3x the requests for support. And that, again, before these cuts. So you've got a hospital system and all the related impacts that are going to be gutted. And so for the life of me, I don't know how you lay claim to being a representative of your district and vote the way they did. Now, they'll have a second chance, and we're all for second chances. Valadao and these guys will have a second chance to do the right thing. Did the wrong thing. He voted for these cuts. He was part of the group that voted for him. When they come back, he has a chance to stand tall. And if he doesn't, I think he should stand down. I don't even think he should run for re-election. What claim do you have that you're a representative of the people in a district with 64% of its population that are on Medicaid? So I certainly hope, to your question, that we can persuade, and the vast majority of American people are overwhelming in their opposition to this betrayal and this bill. And it's our job to get those that may not be as familiar here in the state of California about its direct impacts to start to rationalize that this impact is directly coming to you.
Our next question in the queue goes to Sophia Bolog. Sophia, please unmute yourself.
Hi, Governor. Your rhetoric toward President Trump has become much, much more critical in the last couple of weeks. And I wonder, how has that affected your relationship with the president? And how would you describe sort of where your relationship with him stands at this moment?
Well, you have to ask him. I have an open hand, not a closed fist, but I stand tall when you're attacking vulnerable people, when you're creating chaos, when you advance policies that I think are cruel at the core, when you vandalize the economy, the tentpole of the American economy, California, with these tariff policies and trade policies, including even today, in more impulse in terms of new tariffs in Canada. So we'll stand tall in that respect. The areas he wants to work, we'll work with him. So look, I last time I talked to him was on the 6th of June. Was a very good conversation. And President of the United States calls. President of the United States wants to work with the state of California. I'm absolutely committed to doing so, just as we did through COVID. And I hope to continue to do as we rebuild LA and try to rebuild this democracy. But I'm not naive that working with Donald Trump is a challenge at best. One thing I will never do is work for him.
Our next question goes to Ashley Zavala with KCRA 3. Ashley, please unmute yourself.
Hi, Governor. I want to sincerely thank you for making yourself available today. I know you mentioned that the state budget is being passed here at the legislature, here at the Capitol. I just want to ask you about basically the contingency plan with the current state budget, which I know you've indicated you basically won't sign the state spending plan for now if you don't get the bill that would reform California's Environmental Quality Act to make it easier to build housing. Just if you could just tell us why right now in this moment during the fast track process instead of waiting until like September to figure this out.
Because we have a crisis. We have a crisis of affordability. We've had a crisis of affordability. And while we've made great progress, and you've been part of that, and I've signed more CEQA reform bills than any governor probably in modern history. And we've made a lot of progress in terms of housing and zoning reforms over the course of the last many years. It's not enough. We need to do more. We have to be bold. And I really applaud the leadership of Buffy Wicks, applaud the good work of Scott Wiener and members of the legislature. There's some real leadership there that recognizes the urgency of the moment. And we don't have any time to wait. And so I've been very clear. I was clear in my budget presentation, which you participated in. And I think most of you that are here today, that this was foundational and critical. And we wanted to get it done, get these laws going in effect quickly, and send a message to folks out there. We mean business about addressing the original sin in this state, affordability, addressing the supply-demand imbalance in this state, and address some of the regulatory thickets that remain in this state. So I'm very grateful the progress we've made, and I'm very confident that on Monday I'll be signing those bills, and we will be moving forward on continuing our momentum to advance even further reforms.
Our next question in the queue goes to Eitan Wallace with Nexstar. Eitan, please unmute yourself.
Hey, Izzy and Mr. Governor, thanks for taking the time. Coming to you from the Capitol, forgive me, it's a little bit noisy. First of all, I want to echo what Ashley had to say and say thank you for taking this Q&A. We do really appreciate it. Two very quick questions. Number one, Mr. Governor, first on the state budget, what do you appreciate most about it, Governor Newsom, and what was perhaps the biggest disappointment for you before you signed this thing? And number two, on behalf of KTLA, just wanted to ask about the Fox News lawsuit. What is the message you want to send to Fox News Channel and those who work there, Mr. Governor? Thanks for taking the time.
So on the budget, I'm mindful votes are happening in real time. So I'm going to respect that, and also I hope you appreciate and respect that I'll have a lot to say after we sign this budget. And as Ashley implied, or at least inquired, the housing component parts that will trail at least a few component parts on Monday, and we'll have a lot more to say. In fact, on Monday, we'll be having a conversation with you and others, and we'll invite you into that press conference on the signing. So I'll get into the details of my feelings and sentiment about the budget. But I am just tonally, in this respect, deeply grateful for the leaders of both the Assembly and the Senate, the budget chairs in the respected houses, for their collaborative spirit. This was not an easy budget. There's so much uncertainty that marks this moment. We highlighted that today. And that spirit of collaboration, cooperation, compromise was once again demonstrably on display in this process. So in that respect, I'm very, very pleased. As it relates to Fox, I'm not pleased. Donald Trump lied about a phone call he had with me, quote unquote, the day before. Fox chose to cover up that lie. Fox chose in multiple instances to amend, omit, and edit facts that were in evidence in order to shape a narrative that was malicious, which was defamatory. And as a consequence of their lies, as a consequence of their lack of journalistic ethic, as a consequence of crossing that red line as it relates to news, we filed a defamation. I filed a defamation lawsuit against them. They seemingly have learned nothing from the Dominion lawsuit, of which they settled for an unprecedented $787 million. Fox News is a propaganda network, the national news. Local Fox affiliates do an extraordinary job. Back to your question. My message to the newsrooms of most of the Fox affiliates, thank you for being excellent journalists. Thank you for having ethical standards. Thank you for doing your best to communicate truth and build trust. But there are some at Fox that simply do not abide by that basic principle. And as a consequence, they need to be held to account. It is not because I'm, quote unquote, sensitive to the coverage on National Fox. I've been a piñata for Fox News for years and years and years. Never, however, have I seen that line crossed in such a clear and distinctive way. Jesse Waters and John Roberts. They should apologize. They should spend as much time on the apology they did weaponizing the lie that was shared not only by the 65 million people that are part of Fox News and Fox Business, but by the hundreds of millions that shared that lie around the globe. They should issue that apology. If they choose not to, we have this lawsuit. They need to stop the lies. That's simple. And that line was crossed. And again, I didn't do this lightly. This is not money I'm seeking for myself, the punitive damages. It would be money to go to advance the notion of truth, trust, and transparency. But Fox, the Murdochs, the news at Fox National needs to get its act together and act in an ethical way. They haven't in this instant, and they're dead to right on this lawsuit. It's crystal clear. They crossed that line and they defamed me.
Our next question in the queue goes to Alexei Kosov. Alexei, please unmute yourself.
Hi, Governor. My questions are also related to these CEQA provisions in the budget that you wanted and which landed today. Obviously, there was a lot of back and forth to get to this deal on, on this approach. And, it was a demand of yours in the budget. So I'm wondering why, if you could speak to why you were so insistent on having this in this budget, why it was so difficult to get to an agreement with the legislature on this, and whether even after you had to make changes because of some labor pushback, you still feel that these will be as strong as you wanted them to be.
I exceeded expectations. This is a triumph. I want to see this vote on Monday, one of the most significant housing reforms in California's history. Big day, getting these amendments crossed, getting that 72-hour process rolling, and getting this to my desk hopefully on Monday. I want to be cautious, careful about that final vote, but I'm very, very grateful of all the hard work that was done in this process. And I'll just refer you to my prior answer. I did it because it's critical and it's essential that it was done. It's critical that we address the issue of the lack of supply and affordability of housing in the state of California. We've got to get out of our own damn way. It's code red for this state. I've said it on many occasions. I'll repeat it again. It explains more things in more ways and more days about the challenges this state faces. The issue of housing and affordability. It directly connects the issues of what's happening on the streets and sidewalks. It directly connects with the issues as it relates to working families and the middle class in this state. And so, again, my state of mind is resolved, and I'm grateful that legislative leaders and the authors of these bills did everything in their power to meet this moment. And if this continues as it appears to, and we get this thing done on Monday, we'll have a lot more to say about it. But what's in these bills is extraordinary, and that progress will mark an important historic moment on housing policy in the state moving forward.
Governor, we have 3 remaining questions in the queue. Our next question goes to Antonio Ray Harvey with California Black Media. Antonio, please unmute yourself.
Yes, good afternoon, Governor Newsom. I actually have 2 questions, but let me start right here. In your budget, you have $110 million allocated to Proposition 36 funding. Just want to know how did you and your administration come to that number when the Republican at the state legislature were asking continuous funding $400 billion.
Well, Prop 36 has just gone into effect. It builds off the remarkable number of bills that I signed in partnership with the legislature, I think over a dozen, to address the issues of retail theft and to address the issues of prosecution of organized retail theft. Prop 36 tended to focus a little bit more on drug possession and issues related to not only possession of drugs, but the prosecution of that possession into state prison and state custody. We put $100 million in the budget over the next number of years to support the courts in the adjudication of the facts of these cases that will be brought in front of them, to public defenders, as well as to treatment programs, of which, as you know well, we have provided more support for than any modern administration. This is specific to behavioral health and substance abuse issues. So we added additional funds in that respect. And so we landed on that as an estimate. We also, of some of the need, we also, as you may recall, had budgetary impacts related to Prop 36. We are estimating it will increase at a cost of over $130,000 per year our prison population per inmate. It will put pressure on some of the other reforms, the other criminal justice reforms that have been proven very successful, public safety reforms, and slow down the reduction of total number of prison closures at a cost to the taxpayers. And as well, it redirects money from Proposition 47. It will redirect money, take away savings under Proposition 47 to move money away from drug and alcohol treatment programs, mental health programs, and victim support, but will do so under the rubric of what the proponents of Prop 36 were promoting. So those are other budgetary impacts above and beyond the $100 million that the legislature and I landed on.
And thank you. For my second question, earlier you mentioned that these policies, Trump policy, may affect hospitals. I just want to know, have you administration looked at the impacts that it would have on rural communities for people who probably don't have hospitals around their area and probably have to drive 1 or 2 hours to get to one? Could you answer to that too, how that would impact these communities?
Well, I appreciate you painted the picture about people quite literally having to drive 1, 2, 3 hours to get access to care, something we should not take for granted, and something candidly we'll no longer be able to take for granted if Donald Trump signs this betrayal. He's betraying the very people that disproportionately supported him, many of them living in rural parts of our state in California, and many that will see their hospitals, those hospitals that are still difficult to access, hospitals that are not necessarily proximate to their homes and places of worship and work. Many of them will likely, it's not a gross exaggeration, I don't think it's exaggeration at all, many will likely simply go out of business as a consequence of this betrayal. So we laid that out in the slides I just presented a moment ago. We highlighted the 16 hospitals that we've already identified, 16 disproportionately, not all exclusively rural, but disproportionately impacting the distress program, the rural parts of our state, these hospitals that sought emergency loans of $300 million. They wanted almost close to $1 billion at the time. Those should be Exhibit A, B, and C of a preview of things to come if their representatives in those districts betray their voters and betray hospital leadership and put those hospitals out of commission, people out of work, and people struggling to access care.
Governor, our second to last question goes to Dan Moraine, freelance journalist. Dan, please unmute yourself.
Governor, thank you. There are 505,000 people with intellectual and developmental disabilities covered by the regional centers. I am wondering whether any of these Medicaid cuts are going to affect any portion of the 505,000 individuals. And if so, whether you have raised that with Secretary Kennedy.
Yeah, no, look, I appreciate that. I'm going to ask Secretary Johnson or Director Bass to answer that with more specificity. But let me, if I may, just a point of indulgence. And this is not to patronize. Thank you for bringing up the developmental centers. Rare do people bring the developmental centers up. It's a point of deep pride that California makes the kind of investments we do. And I'm deeply mindful that we need to make significantly larger investments. And it's been a point of tremendous friction in the budget negotiations because of so many competing areas of our budget. And so often DDS is overlooked. And again, I recognize my own responsibility in that space. I'm proud of the master plan we put out. I'm proud of the fact we got a pathway in terms of a vision to provide more support and more stable funding, but it's not enough. And so the vulnerability to that system in light of these cuts only magnifies that. And so Director or Madam Secretary, if you could perhaps answer with a little bit more understanding and detail.
Sure. Just to say, a large number of the population you just referenced who's accessing developmental services is also enrolled in Medi-Cal. So there are no exceptions there in terms of the impact that it could have. Some of the work requirement proposals do provide some exceptions for that specific population, but in large, the impact will be felt by those individuals. And just to say, again, the individual who's enrolled in Medi-Cal is also likely also engaged in CalFresh and maybe even developmental services. So these proposals are going to have multiple impacts on that one family, that one household who will not have the same food resource, access to healthcare resources, and will have a very devastating impact as many of our program participants are actually participating in multiple programs. So the short answer is yes, there will be impact for those who are also enrolled in the Medi-Cal program.
Our final question goes to Angela Hart with KFF News. Angela, please unmute yourself.
Hi, Governor. Happy Friday. As you know, most but not all of the funding to cover the expansion or to cover healthcare for undocumented immigrants in California comes from the state. The federal government kicks in a share for the emergency portion. I have a two-part question for you. Are you concerned that the federal government, that the Trump administration is going to come after that funding somehow. And separately, are you concerned about the sharing of Medicaid enrollment data with not only CMS, but once the state sends over the Medicaid enrollment data for undocumented immigrants to the federal government, that it would be shared beyond CMS, perhaps to DHS or other immigration authorities? Does that give you concern?
Of course, it long has, and that's clearly, it appears to be happening, not just CMS, but other databases. That was highlighted in multiple reports as it relates to some of the activities of DOGE, et cetera. Of course, they're trying to weaponize these databases that have been sacrosanct in the past. And so, yes, that concerns me greatly, concerns our diverse communities all throughout the state and providers, and it's created a chilling effect. So we're deeply concerned about that, and certainly concerned the first part of your question that Trump, of course, he's doing that on the FMAP. That's the $4.3 billion penalty on that 10%. That penalty is intended, again, to go after states that provide care to people, again, without ability to pay, pre-existing conditions, or immigration status. Choosing to do that, as you suggest, with state general fund money, a decision state policymakers and their representatives make to stabilize populations, reduce uncompensated care, support our emergency departments and hospitals, particularly those most vulnerable in our rural communities, and support healthy and thriving families. And so, no, this is they mean business as it relates to their assault on these programs and these databases.
Governor, that's it for the questions.
Well, thanks, everybody. We'll be back on Monday. As I said, hopefully we'll have a lot more to say on the budget and the housing bills. No, not hopefully. We will have more to say on the budget and housing bills. Well, certainly more to say, though, I think, on this subject matter as things get clearer and we see what other shenanigans they come up with and other assaults on the health and safety of our communities all across California. But I appreciate everybody's indulgence, and I hope we can share some of the information that we provided today. Thank you.